Okay, let's unpack this. I mean, chances are you've got your phone right there, maybe even in your hand listening to this.
Oh, absolutely. They're just part of us now, aren't they?
Totally. They connect us, keep us entertained, all that good stuff. But what about the other side? The impacts maybe we don't think about quite as much, the, health side?
Well, that's exactly what we're digging into today.
Hmm.
We want to shed some light on the specific health consequences of using smartphones, maybe a bit too much.
Right.
And we're basing this on a pretty interesting study, actually. It's a 2025 cross-sectional study out of Turkey, focusing specifically on university students and this thing they call mobile phone addiction, or MPA.
MPA, okay. So what did they find? How did they even measure this?
Good question. So they took 293 university students, all young adults, sort of 18 to 25.
Hmm.
And they used a standard questionnaire, the smartphone addiction scale, the short version, SAS-SV, to divide them. They had cutoff scores, slightly different for males and females.
Okay, so they split them into an addicted group and a control group?
It's exactly. 142 in the addicted group, 151 in the control. And the big difference, maybe not surprising, was daily usage. The addicted group reported median of 300 minutes a day.
Wow, 5 hours.
Yeah, compared to 240 minutes, so 4 hours for the control group. And statistically, that difference was highly significant.
An hour more per day on average. That definitely adds up. So where did they see the impact?
Well, one of the really fascinating bits was cognitive performance. The addicted group scored significantly worse on something called the Cognitive Failures Questionnaire.
Cognitive failures. What does that actually mean, like in real life?
It measures those everyday slips, lapses in attention, memory,
Yeah.
forgetting why you walked into a room, misplacing your keys more often, maybe finding it harder to follow a conversation.
Okay, got it. Like brain fog.
Kind of, yeah. Their median score was 40 compared to just 29 in the control group. Big difference. And the researchers think this links partly to poorer sleep quality and just general fatigue, that blue light effect.
Right, the blue light messing with sleep. Makes sense. What about physical stuff? Did they look at that?
They did. Eye health was another key finding, specifically dry eye symptoms.
I think we could all relate to that one after a long day on screens.
Definitely. The addicted group had significantly higher scores on the Ocular Surface Disease Index, basically. More symptoms of dryness, grittiness, irritation.
So it's not just anecdotal. The study actually measured it.
Exactly. Median score 25 versus about 16.7 for the control group.
Yeah.
And it probably comes down to, reduced blinking when we're staring intently, which makes the tear film unstable, plus maybe some oxidative stress from the screen time itself.
Okay, so tired eyes, foggy brain, anything else?
Yes, absolutely. Hand discomfort. This was quite specific, actually.
Oh, how so?
They found significant discomfort reported in the thumb, index, ring, and middle fingers, but specifically on the right hand for most people.
The dominant hand, usually.
Precisely. And they even pinpointed specific zones A and C, which is sort of the base of the thumb and across the palm area.
Huh. So it links directly to how we hold and use the phone.
Seems like it. Those repetitive taps and swipes, gripping these larger phones, often one-handed, it puts strain on very specific areas. It's an ergonomic challenge, really.
Makes sense. You add that all up. Cognitive issues, eye strain, hand pain. I imagine people just felt generally run down.
That's the next piece, fatigue. The addicted group reported significantly higher fatigue levels, too. Their median score on the Chalder Fatigue Scale was 15 compared to 13 for the controls.
So, more tired, both mentally and physically.
Yeah. And it's likely all tied together, the excessive screen time, maybe poor posture while using the phone, and critically, that poor sleep quality we mentioned. It becomes a bit of a vicious cycle, doesn't it?
It really does. Bad sleep makes you tired and foggy. Being on the phone strains your eyes and hands, which maybe makes you feel even more drained.
Exactly. This raises an important point. These aren't really separate issues. They're interconnected. Poor sleep worsens cognitive problems. Eye strain and hand discomfort drag down your overall sense of well-being and energy. Overuse kind of ripples outwards.
So what does this all mean for us, for anyone listening? The takeaway seems pretty clear.
Yeah, I think so.
This study strongly suggests that, what it calls mobile phone addiction has real, measurable, negative health effects, especially noted in young adults here, but honestly, it feels relevant to anyone glued to their device.
Absolutely. It's not just about wasting time. It has physiological consequences.
Right.
And the study really highlights the need for, awareness, first off, and then maybe thinking about interventions.
Like what?
Could be simple things. Maybe some basic ergonomic awareness, how you hold your phone, taking deliberate screen breaks, the 20-20-20 rule for your eyes, perhaps?
Stand-up stretch.
Yeah, or even trying out a short digital detox now and then. Just stepping away completely for a bit. It really makes you think, what small adjustment could you make today? Something to help your focus, ease your eyes, maybe give your hands a break, and just boost your overall energy.